Welcome to our dive into the fascinating world of psychiatric disorders, a realm where biology, psychology, and everyday life collide in the most intriguing ways. Today we're going to explore how scientists are unraveling the mysteries behind conditions like depression, anxiety, schizophrenia, and even bulimia nervosa, all while keeping it light. First off, let's talk about the psychiatric disorders. Think of them as complex puzzles, sometimes a little epiphenomena here and there, but most rooted in a tangled web of biological, psychological, and environmental factors. Scientists are constantly hunting for biological measures or biomarkers to help better understand these puzzles. Biomarkers can be anything from single nucleotide variants to levels of neurotransmitters in cerebrospinal fluid. Neurochemistry, the study of chemicals in our brain, is a key player. For example, the serotonin system has long been studied for its role in mood regulation and anxiety. But it's not just about chemicals, neurocircuitry matters too. The cortical limbic circuits, the brain's emotional command center, and when they get dysregulated, say through hyperactive synaptic pruning during development, it can contribute to conditions like schizophrenia, spectrum disorders, or depression. How do we measure these brain changes? Electrophysiological biomarkers like EEGs help peek into neural activity, while advancements in neuroimaging allow us to visualize neural disconnectivity. Identifying these biomarkers isn't enough. We need to validate them both internally and externally. Internal validation checks are if our findings hold true within a single study, while external validation tests their robustness across different populations and settings. And to make our predictions more reliable, scientists use techniques like cross-validation and resampling. Once we develop promising biomarkers, the next step is clinical trials, rigorous studies to see if these markers can predict treatment response or help tailor therapies. This is where the concept of clinical utility shines. Do these biomarkers actually improve patient outcomes? That's the ultimate goal. Speaking of treatments, we have a variety of options. Evidence-based treatments include pharmacological approaches like medications targeting the serotonin system or other neurochemical pathways, and psychotherapeutic approaches such as cognitive behavioral therapy, psychodynamic therapy, or even psychoanalysis. Each has its place, especially when dealing with comorbidities. Conditions like depression and anxiety often appear together, complicating diagnosis and treatment. Let's not forget the importance of understanding the pathogenesis, the biological and psychological processes leading to these disorders. Factors like genetic predispositions, epigenetic modifications, immune response, endocrine imbalance, and even the enteric nervous system all play roles in this complex story. Finally, considering social issues entwined with mental health, stigma, access to care, and support system, reminds us treatment of psychiatric disorders isn't just about biology. Thanks for joining me on this journey through the intricate and fascinating world of the mind.